The Philippine Health Insurance Corporation says it will shoulder the testing costs for COVID-19, this on top of expenses for quarantine and isolation. Cabinet Secretary Carlo Negrales says the last thing that government wants is for citizens to worry about medical costs and expenses. The government is also fast-tracking the deployment of test kits to areas affected by COVID-19. The Department of Health has denied reports that hospitals are turning down patients under investigation for COVID-19. But as Pat Manguni reports, some private hospitals are referring PUIs to other hospitals due to limited capabilities in handling cases. Her report.
Earlier on Wednesday, an internal memorandum from the medical city in Pasig circulated on social media. It said that due to manpower limitations, the hospital will temporarily stop admitting patients under investigation for COVID-19. Pasig City Mayor Vico Soto clarified this does not mean the patients will be rejected, but will instead be referred to other hospitals. But the medical city in a later statement clarified the matter. An internal memo to temporarily control the inflow of new COVID-19 patients was maliciously leaked to the public. TMC now handles 8 cases of COVID-19 and 31 PUIs, which exceeded their daily load of patients. While this has taken a toll on their resources and personnel, the hospital said it will continue to attend to all patients as long as their capacity allows it. The health department meanwhile said hospitals are not turning down PUIs, but that those with mild symptoms are allowed to go home pending test results. According to the DOH, levels 2 and 3 hospitals can accept PUIs.
Ang mga ospital po natin ay tumanggap po ng mga patient under investigation na may mild symptoms.
The Private Hospitals Association of the Philippines claimed that they are prepared, but end up referring cases to other hospitals due to limited capabilities in handling infectious diseases. This is to avoid mishandling and the further spread of the contagious disease.
Prepared in a sense that we have one infectious room in every hospital because you cannot be given the license to operate unless you have one.
Aside from this, private hospitals do not own COVID-19 test kits at the moment, with bulk of the supply going to state hospitals under the health department.
We will still see it after 1 or 2 days. We send the specimen to RITM kung available. Kaya the fact hindi naman nagbibigay ng WHO sa amin eh. It's always through DOH kasi yun natang protocol nila.
As a temporary preventive measure, some private hospitals set up a triage tent to filter patients or visitors while checking their temperature and provide hand disinfectants. For News 5, Patricia Manguni. We are One News.
The DOH has ordered all public hospitals in Luzon and NCR to convert all their private rooms and wards into isolation rooms for COVID-19 cases. These hospitals are also directed to discontinue admission of private patients within 24 hours. Last Tuesday, the Food and Drug Administration approved the first locally made test kits for COVID-19. The test kit was developed by the Philippine Genome Center and the UP National Institutes of Health. This is how the test kits look like. It will be produced by Manila Health Tech Incorporated. Even if the FDA has given the kit a nod, they will only be for parallel testing. There will still be confirmatory tests using the old test kits to determine the accuracy of the new kits. The new test kits have 3 vials. The first one is called the control vial, which does not contain the virus. The second one will have a sequence of the COVID-19 virus, while the third one would be from a patient specimen. The kit is meant to do DNA sequencing or the separation of sequence or order of the elements of the DNA. For example, this will determine the arrangement of 5 nucleotides to see if it matches the sequence of COVID-19. Should the test kits pass the DOH confirmatory test, it will greatly help in confirming COVID-19 cases in the Philippines. Every box or kit can conduct 25 COVID tests. The production of the test kits started Tuesday, and before the week ends, the manufacturers say they can make 40 test kits, which can conduct 1,000 tests. And for the succeeding weeks, they can double the production of these kits. Most importantly, these local test kits are cheaper at 1,200 to 1,500 pesos each. That compares to imported ones, which cost up to 10,000 pesos and more. The local test kits can also produce results in 1.5 hours. The Philippine Genome Center and the National Institute of Health are also the creators of the first local dengue test kits, which are currently being used in the country.